Well, we're excited here to kick off a little sad that this is the end of our virtual conference. It's been awesome. It's been such a great couple of days, and we are definitely going to go out with a bang. I am very, very excited to get ready to introduce a new segment, a session we came up with this year because we have realized how many new, and I use new with quotes because some of these folks were new only about 18 months ago and are now just rocking in the free world. So I'm really excited to have so many different programs and folks who are becoming good friends of ours, speaking up so much on our learning collaborative meetings and so forth, really able to share some pretty sensational insights for being new, as it were. And another reason we wanted to have this session today is to encourage those of you who feel like, kind of babes in the woods, that you too will make it this far, hopefully this quickly, with our community's support. So with that in mind, I'm excited to introduce our three key speakers, or rather three key groups, because we have a duo kicking us off for our 2020 yearbook. Everyone will speak for a quick 10 minutes, and then we'll have a good 10 or so minutes to ask everyone their questions, burning questions, and see if they can help you since they're a few steps ahead of those of us who are new. And for those of us who have been doing this for a while, also asking questions about what may be new to us. So without further ado, I'm going to turn it over to our colleagues at the Maryland Department of Health to share some of the highlights from their work in partnering with local and county health departments in implementing their statewide AD project on opioid safety. So Anna and Christopher, please go ahead and kick us off.
Thanks, Devin. Hi, everyone. Good afternoon. Thanks for holding on to the end to the last session. As Devin said, I'm Anna Gribble. I'm here with Chris Shea. We have no conflicts of interest. I do want to share that Chris is partially supported by a fairly funded grant managed by my office, but I promise his participation in this presentation was not a condition of receiving funds. He really is here to say nice things on his own.
Yes, I am.
Thanks, Chris.
All right, you guys ready for your poll?
Yeah.
All right.
Before we jump in,
poll.
Go ahead.
Oh, you go right ahead. No, you go right ahead, Anna.
Thanks. We were really interested to see, for those on the call, has your academic detailing project partnered with local health department staff? Whether that your detailers are health department staff, you've connected to your local health departments. I realize this may not be applicable to some of the international members on the call, but just to get a sense.
It looks like more than 50% say yes, Anna and Chris, that nobody's unsure, which is lovely, that about 13% say it's not applicable, and about 30% say no, which hopefully means no, not yet. Thoughts about that?
That's awesome to see. Great. We love working with our local health department staff. They're full of wonderful resources. So it's really awesome to see that people are already partnering with them. Cool.
All right.
A little bit of information about my office and where I'm situated in the Maryland Department of Health. My office includes both the Prescription Drug Monitoring Program and the Office of Controlled Substances Administration. And really, our office really seeks to provide a center of support for both prescribers and dispensers, promote professional education, inform clinical decision-making, all with the goal of improving patient care in Maryland and reducing overdose deaths. Next. Some background on our project. As Devin said, we are a newer project. We started in the summer of 2019. We had a pilot year. We're just beginning into our first year out of our pilot. We're using funds from both CDC and SAMHSA. Our partners, first and foremost, are our local health departments. We've also worked with NaRCAD, the University of Maryland, and we're now working with the Center for Innovation in Academic Detailing on Opioids, CHOW. And the goals of our project are to improve opioid prescribing practices, increase clinician use of the state's prescription drug monitoring program, prevent opioid-related overdose deaths, as well as augment the skill set of the Maryland public health workforce. And that last one really hones in on our priority to work with local health department staff to implement the project. On this slide, you will see the really funky geographic layout of Maryland. That is Maryland. We have 24 jurisdictions in our state, and the ones in yellow are the pilot jurisdictions. So each jurisdiction has a local health department, and in our pilot year, we work with the 9 health departments in yellow. On the next slide, you'll see that we've expanded in year 2 to 13 jurisdictions. And one reason why I wanted to show the map of Maryland, not only to remind everyone how funky it is, but also to show our geographic distribution, that we've really been able to expand this project throughout the state. And these counties include both rural and urban areas in Maryland. On the next slide, this really gets at the meat of what we wanted to share today, is why we wanted to work with local health departments. We've heard some really great presentations from academic detailing projects that have worked with universities and working with pharmacy students, or working with private groups, or clinicians detailing directly to clinicians. We kind of assessed all of those options when figuring out our project, and we decided that we wanted to work directly with local health department staff. Maryland has a really good relationship between the State Department and the local health departments. We have a pretty robust public health system in our state. And we also know that local health department staff, they know their jurisdictions very well. They know who the big healthcare systems are within each of their jurisdictions, and many of them are very well connected to them. And Chris is going to share a little bit about that in a second. We also know that local health department staff have already been doing a lot of overdose prevention, opioid-related work within their communities. And local health department staff some of them have already been going out and seeing providers. And really what that looked like a few years ago was printing out some CDC fact sheets and handing it off to an office manager. And I don't want to minimize that work, but we saw that happening and we thought, how can we improve those touch points with healthcare providers, and academic detailing really fit within that project. On the next slide, some more background on who are our detailers. So as I said, a lot of our local health departments have already been doing overdose prevention work, and a lot of our academic detailers are very tied into those projects as well. Some of our detailers are also their county's overdose fatality review coordinators. Maryland has a robust fatality review project. Many of them are also their county's naloxone outreach coordinators. Some are their BEEP expansion coordinators. Some of them manage local level communications campaigns on drug misuse. Almost all of them have experience with hosting CME events or health fairs. They're very knowledgeable about the language when it comes to opioid overdose prevention and overdose work. Some of them have, all of them have backgrounds in public health, they're public health staff, but some of them have actually worked in clinical settings before. We have one new detailer who's been an office manager before. Some of them are social workers, and we actually this year now have an ENT and a physician in 2 different counties, which is really exciting to have a diverse background for our detailers. And on the next slide, I think we have some of our successes from the past year, or our progress so far. We've been able to host 2 101 trainings for our detailers, one with NaRCAD and one with CHOW. Actually, the very last session with CHOW is happening right now, so it's going back and forth between the 2 presentations. But we are really happy to be able to offer these trainings so the detailers have the skill sets and feel really confident with the content when they're talking with healthcare providers. From July 1, 2019 to October 1, 2020, we had around 119 field visits that were completed with healthcare providers. That's 119 visits where a local health department staff successfully completed a visit with a Maryland healthcare provider, which is really exciting for us to share. In March, we also worked with the University of Maryland to offer CME credits. But we all know what happened in March, so we don't have a ton of information about CME credits, but we hope to soon. On the next slide, I think this is some data from our detailing session report forms that each detailer completes after they visit with the provider. It's a little hard to see, but the orange 52% of the circle, that represents 15 to 30-minute sessions with providers. The 24%, the blue, is less than 15. The gray and yellow, that makes up 30 to an hour. This is exactly what we had hoped to see, that our detailers are really implementing the project as we had hoped, having visits that last somewhere between 15 to 30 minutes. And then the next slide, we show some data from another question we asked our detailers on the report form. And this is based on the detailer's perception of how well the visit went from 1 to 5. We're really happy to see the 5 of over 60%. We're going to ask a similar question on the CME surveys. We really hope to see providers have the same perception of the visits. If not, that's an opportunity for us to address. But at least from the detailer's perspective, things are going really well with these visits. On the next slide, I think this is where we get to some successes. Yes, we're really happy to see the number of providers that have been visited by our detailers. We also were really happy to see that detailers were able to leverage their existing relationships with providers and their health department, which is what we had hoped and why we wanted to work with them. Detailers have worked really closely with their health officers and local level leaderships in order to get in the door to healthcare providers and be able to detail with them. You know, even though my office manages the PD&P, I've tried so hard to get them lists of providers in their jurisdiction, and, you know, can't quite do that without a statute change, but I'm really impressed with the detailers and their ability to go out there and hustle and find providers. Our detailers have also been able to deliver a variety of messages, which is really exciting. We were nervous that the detailers who were their naloxone outreach coordinators in their jurisdictions, for instance, would only be talking about naloxone with providers. And that's not what we've seen. We've seen that the detailers feel really confident and comfortable talking about many of our opioid-related messages with providers, which is great. And the detailers have also been, as all of us have needed to be, really flexible and able to evolve, especially in light of COVID. They've thought of new and different ways of reaching out to healthcare providers, which is great. But I will say in our challenges, COVID has been a big impact on our ability to go out there and see providers. It's been a struggle for them to get in the door in order to schedule visits. So our pivot and how we're addressing that is we're offering additional TA time, so additional time for peers to learn from peers on monthly calls, additional time for detailers just to practice what does it look like doing an e-detailing session. So we're doing something like this where a detailer will practice doing a visit with a provider and I pretend to be a provider. We've developed some e-detailing guidance that's specific to Maryland, and that was really based on those wonderful calls that NaRCAD put on with the roundtables on how to implement e-detailing, where we've learned from many of you on the call, so thank you. Another barrier, something when I talk about this project I hear frequently is, don't you struggle with these health department staff who aren't physicians talking with physicians? How are they really conveying the messages? Do they really know what they're talking about? And they do. And our experience has been that the providers that have received detailing from these well-trained, well-versed academic detailers, really, they're receptive. They want to know what their local health department has as far as resources to help them. They've been really receptive. And the detailers, especially with their great experience in overdose prevention and public health, they have valuable information to share. And a lot of that comes back to reassuring them that they do, but they really do have great experience to bring to the table. We were concerned about none of our detailers really being full-time detailers, but really we've seen that we've been able to leverage their work with their fatality review teams and naloxone outreach to find providers, so it's really benefited all of the projects. We've seen some turnover in staff, and that really has to do with detailing being very new to Maryland, where a local health department thought they had someone who'd be great for a detailer, but it turns out they needed to change it up and have someone else serve as a detailer. But we've also had several detailers who have been with us since the beginning. I'm actually going to pivot now to Chris, who's been one of our detailers who's been with us from the beginning to share his experience of being a detailer in Maryland. And turn over to you, Chris.
Great. Thank you, Anna, and appreciate all that you're doing for our support to really help us in the local health departments and, you know, what we're working on. One of the things just to mention quickly that Anna talked about with the CME data since March and the whole COVID, I continue to push that with the prescribers in the county, and that really is a important piece that helps to attract you know, prescribers to speak with me. So very glad that we have that, and I would suggest you know, every locale who can to do the same things. That really is a draw, especially with COVID. It's hard for all of us to get our CEUs, CMEs. So anything that can help, you know, people are going to jump on. So what we're doing, I'm in St. Mary's County, and on that Maryland map, that would have been way on the bottom of the map. Our county is somewhat rural. We are unique in the sense that none of our physicians are in private practice. So all of our physicians work under the umbrella of the MedStar Corporation. Our local hospital is a MedStar hospital. There are many MedStar facilities elsewhere in Maryland and through DC. So the only practitioners that have their own office space are people like dentists, but your physicians are all under that umbrella. The positive to that is I don't need to go searching for practitioners. I just need to find the 5 or 6 centers that exist and work within those centers. The downside is we're dealing with corporate policies and agendas. Many of these practitioners who are in these facilities cannot do things on their own. So whether they would want to participate in getting, say, buprenorphine waivered, they would need to ensure that they're allowed to do that. So there's that slight barrier. Since I'm not full-time doing the academic detailing, I am working within our other grant structures, which are very heavily focused on the opioid crisis. So that is my academic detailing focus right now, is helping prescribers to understand the importance and need for them to be waivered, the importance for proper prescribing, the PDMP, and then we've set up alternatives to prescribing, such as we trained about a dozen or so clinicians in CBT for pain, and we also refer out to holistic healing for pain. So helping these prescribers to understand that there are some alternatives that we have already set up for them. We've also now pivoted in COVID, like everybody else, over to the e-detailing and working on helping the physicians to work through that structure. And in the future, what we're looking to do is do more of the online trainings. I'm keeping in touch with all of our prescribers through phone and email and all that. So a lot of great stuff that's happening down in our rural corner of Maryland.
Excellent. Thank you so much, Anna and Chris. And I did put a comment in the chat box. How awesome is it to have the dual perspective of, making things happen behind the scenes and then who's on the ground and how you work together. Really terrific, and a model that I think folks could really learn from. For those of you who don't have an Anna Gribble, you should go to the Anna Gribble store and get one because she is the greatest. We're going to table questions to the
Totally
very end.
agree.
So if you have questions for Anna and Chris, keep them in the back of in your back pocket, and we will we'll make sure that you get a chance to ask those. All right. And now, reporting from the Aurora Borealis, we have Kelsey Bolton, BA. She is from the Gunderson Health System of Wisconsin, and she has quite a few things to share about her academic detailing intervention to support primary care clinicians in supporting their patients with tobacco cessation. Always an interesting topic. Kelsey, over to you. Thanks for being here.
Thank you, Bevan, and the whole NaRCAD team. So I am Kelsey Bolton. I have no financial interests to disclose. I am a continuing professional development consultant in the CME office, the Continuing Medical Education office at Gunderson Health System. So that is located in Western Wisconsin. Next slide, please. So to give you a little background on, oh, sorry, that's in the wrong spot, but that's okay. So I mentioned I'm in CME. To give you a little background on Gunderson, we support 21 counties in a tri-state area, Wisconsin, Minnesota, and Iowa. We became a medical education center in 1944, and we have UME, GME, and CME in our medical education center. And the CME office currently supports over 500 clinicians, and that is myself and 3 other people. And so the reason that we kind of focused on tobacco is because Gunderson, unfortunately, ranks 15 out of 21 in the state of Wisconsin for tobacco cessation. So there was just a great need there. Out of 130,000 patients that we serve, we spend about $56 million per year on tobacco healthcare services. So the need was there. And CME started focusing on that, seeing that need, and was trying to find an innovative way to look at getting that information out to providers, especially because they needed a new way to approach it with their patients because we were kind of getting stuck. Next slide. So I will go to that question. If you want to just answer in the chat box too, I'll make it more open-ended because we have talked about CME over these last few days, but I know that we have a group that is a mix of clinicians and non-clinicians. So if you want to just go in the chat box and tell me, what do you know about CME or what comes to mind when you think of CME? And I see a couple people are already clarifying what UME and GME and CME are, so I appreciate that. So CME is challenging.
Other words come to mind when you think of CME. Go ahead and pop it in the chat box. We're going to take a detour from poll everywhere so Kelsey can have more of an open-ended response. All right, here we go, Kelsey. We're kicking off. Traditional with disease. Yeah, you want to read them? You go for it.
Sure. So I like that we have incentive and then required, which are kind of opposites, but both true. Traditional CME makes you fall asleep. Required, again, too much choice. The post-CE assessment paperwork can be a hook. So again, incentive has to go through approval, lots of constraints and requirements, tedious, didactics. So thank you, everyone. We can go to the next slide. That is what we hear a lot. CME is kind of seen as a requirement, as a department full of just structure. And if you ever give a CME talk, you're required to do a bunch of things. If you go to a CME talk, you are required to do a bunch of things. So at Gunderson, we have really tried to make CME much more engaging than that. So we are always looking for innovational ways to provide that education, and we really get involved in the educational design. Not all CME departments have the capacity to do that, so we are really grateful to be able to do that, invest in some different designs, and academic detailing became one of them. So back to tobacco cessation. We chose this because of that need that I talked about. And so we came up with some objectives. The first one is just to determine the effectiveness of academic detailing on clinician practice change for tobacco cessation. And then secondary, to evaluate the clinician's perception of the usefulness of detailing. And then third, to evaluate those patient outcomes for tobacco cessation. I will share one thing that's kind of unique about my program is that I am the whole program. I trained at NaRCAD in May of 2019, and I am the only person in my organization that is a detailer. So I run the entire program, but I am not alone. I have partnered with our CMO and our CME medical director and a couple of other clinicians, as well as our population health department, to get the data needed to look at this program, and also to put together the clinical information because I am not a clinician. So the CMO and my CME medical partner put together all of the clinical information needed on tobacco cessation and help me practice to learn that and go out in detail. So implementation moved quickly and it was intense. We hit the ground running when I came back from Boston, because we saw that intense need for this tobacco cessation program. And as you all know, training is just practice, practice, practice. That's the best way that you can learn the clinical information and those communication skills. So I practiced on my coworkers and on clinicians that were kind enough to let me guinea pig on them, got feedback on both those communication skills and on that clinical information. I was just learning it as I went. So they would interject with, you know, here's what you could say here. And so I got a lot of help from my medical partners on that. Creating the detailing aid was also a collaborative effort, again, with those medical partners who created the clinical content. And then my marketing department Gundersonized the detailing aid, just as this PowerPoint is Gundersonized, as we all know we have to do with our materials. And then again, just practice, practice, practice using that detailing aid, which we know can be a challenge. You know, how do you kind of naturally present that to the clinician without them just ripping it out of your hands and wanting to read it and not talk to you and engage with you. So again, I can open this up in the chat box. So do you know what NRT is? And in the chat box, if you want to say what it is or what you know about it.
Or again, Kelsey, I loved your take on the last one. What's the first thing you think of when you hear NRT? And maybe we should go ahead and tell them what it means now that we have some yeses and nos, and there's so many nos, and we want to de-acronymize.
Yeah. So
thank you, Teresa and Mike. Nicotine replacement therapy. What do folks think when they hear that? Is it doable? Is it accessible? Do you know anybody who's tried it? I've tried it, but it didn't work. Gum, it's free and not used enough. The patch, OTC, over the counter, accessible. Sleep disturbances. Thanks, Lauren. What else? Let's get a couple more. Inhalers work well at the hospital. Thanks, Charles. Combination NRT. Okay. Different approaches, right? A hybrid approach. Let's see if we can get one more. Only one tool. Thanks, Brenda. I'm going to turn it back to you, Kelsey. How do these responses sound? And Zach Dumont says, NRT needs repeat tries. Ha ha. Thank you, Zach. Keeping us on our toes.
Yes, thank you, everyone. So these are all comments that I've heard from the clinicians that I've detailed. So you've got it. This is what detailing on tobacco cessation has been like for me. Couple notes on, you know, what was said. Combination nicotine replacement therapy is the gold standard for tobacco cessation. So thank you for mentioning that. It is free. Jackie, I hope it is free completely where you are. In the states that I serve, it kind of depends on a few different situations. And one of the key messages that I had was to prescribe NRT, because then insurance may cover it. There are some there's some ways to get free NRT for a month or so where I am, but unfortunately it's not as free as I wish it would be. So thank you all for those thoughts. So nicotine replacement therapy was one of my main messages. The gold standard is that combination of the patch plus the lozenge or gum plus counseling, which is something that a lot of clinicians had not heard about. Kind of a follow-up, keeping in touch with that patient to keep them motivated. And then a few other therapies I talked about too, including hypnosis and acupuncture. And then I also emphasized an EMR shortcut that we had come out with last year that just made it a lot easier for clinicians to make decisions about their treatment of tobacco using patients. I also provided lunch to every clinician that I met with. And we all know that food is a huge selling point. We all love food. So then those were my key messages, and I just collected visit data as I went. Again, this was all just me. So the visit data was kind of your typical, the location of the clinic that I visited, because I visited several different rural clinics, because that was where the greatest need was. The number of clinicians that I met with, the durations of the visits, which varied anywhere from 4 minutes to 25 minutes. And then I also gave them a survey to find both their perception on the detailing visit and what they learned from it. And then I also documented their commitment to change, you know, what they were going to do with their tobacco patients. And just had a simple spreadsheet to do that. So we are turning this into a research project, which I'm really excited about. COVID has stalled that. Again, since I am a solo act, other things have just kind of taken priority with COVID. We all know what that's like. And we are pausing, but we started to gather some really great data on how clinicians were impacted by my detailing visits, and also how patient outcomes started to look different. So the methods were, again, just I completed that training. We created the survey tool, and then the primary and secondary outcomes were measured by the survey and by looking at clinician and patient data. Next slide. So I do have some preliminary results that we pulled from last year into the first half of this year. This is from the survey. So all the bars are going in the right direction. Really happy to see that clinicians felt that they learned different things about tobacco cessation that they either hadn't heard before or had just kind of forgotten, and that they were ready to use some new tools with their tobacco using patients. Next slide, please. And then again, really preliminary results on patient data, or rather on interventions used with the patients. So that survey was just the clinicians saying, here's what I learned and what I might do, but this data tells us what they actually did do. And the data only goes into July of 2020 for obvious reasons. You can see that the numbers started to go down in the summer. I think we all have seen that things have taken a backseat to COVID, unfortunately. So we are paused, but we are hoping to see these numbers start going up again. And then patient outcomes will be coming hopefully in 2021, and we're hoping to see a really positive result. Next slide, thank you. So conclusions that clinician behavior change was optimized through academic detailing. They did learn from it, and they did apply that in their clinical practice. They are more aware of resources and tools at their fingertips. And of course, we have the very optimistic hypothesis that clinician outcomes are going to improve thanks to these interventions. So I just want to share that when NaRCAD reached out to me for this presentation, I said to myself, what success story? But I think we all get a little too in the weeds at times and don't realize until somebody tells us to kind of take a step back and look at what we've done. And it is really cool. And I want to thank this community for giving me that opportunity to look back and say, wow, I did do something kind of cool. And things are moving and shaking thanks to that. And the NaRCAD community has been a huge part of supporting me, because since no one else in my organization even knows half of what I'm talking about when I talk about academic detailing, you guys are my community. And it just goes to show the versatility of academic detailing, all the different ways that it can live and be utilized. And so I'm hoping to continue to do that in my CME department. So please reach out to me with any questions after the conference as well. And thank you again for inviting me to speak.
Thank you so much, Kelsey. Yeah, it was such a pleasure that you responded positively to us asking you to be part of this new yearbook feature. And it's just always so great to see folks who've made such incredible headway in such a short period of time, and you are no exception to that. Again, hold on to your questions. I know we have a bunch of stuff popping up in the chat box. Want to make sure that we do end on time today, so we're going to go straight through to our friend Vishal Kinkabwala. He is the HIV Prevention Activities Coordinator at the Michigan Department of Health and Human Services in Lansing, and he's going to talk to us about his HIV prevention detailing program, which had to, as many of us have, had to pivot during COVID. So we're going to learn from him, and any questions we don't get to for the yearbook folks, we will make sure there's a yearbook thread or room on the discussion forum to follow up. All right. And now joining us from a mountaintop is Vishal.
Thank you so much. It's a pleasure to present for everybody. So getting through the disclosures, no conflicts of interest to declare at this time, and no relevant financial or non-financial relationships to disclose. So the first thing I want to do is, because this is going to be a reflection on 2020 and sort of just talking about what's happened and what we've learned, if everyone could, take a quick moment to just type in a word or phrase to describe how 2020 has impacted your work here, if you had to sort of sum it up. We're definitely getting some very unique words here.
Including WTF. All right. Frustrating, Zoom, stressful, happy, unique, pivots, a mess. I see the word hot too. I'm going to put that with hot and mess together. Zoom is the biggest. I hope we can get something else a little bigger than that. But, Zoom's our friend. It's making the moment right now happen. Innovative, change, exhausting, lonely, drama, hot drama. Wow, lots going on here, Vishal. Do any of these words resonate for you personally?
Oh, absolutely. I think scrambling is a big one, and somebody said creative, and whoever said creative, I think you're absolutely right on the money too, because that's kind of one of the biggest lessons that I think I've learned this year is, getting those creative juices flowing out of both necessity and out of desire. So that's one thing that I'm hoping to sort of focus on in this presentation, but these are all great words. Oh,
especially the word puppies. I see puppies, which I know that our own director got a puppy this year. So there are some times where you just need to go out and get a puppy. All right, back over to you.
Thank you so much. I think puppy is very, very true. So I'll kind of start by just giving you a brief intro on our detailing program. So I'm part of the Michigan Department of Health and Human Services HIV prevention unit. So our academic detailing program is focused on PrEP and HIV prevention. I am actually a part-time detailer. My main work is with the Ending the HIV Epidemic initiative, which is focused in Wayne County in Michigan. But as part of it, I do academic detailing in Southeast Michigan and throughout the state. Our program started in September of 2019 with our full-time detailer, my wonderful colleague, Mary Nagy, who was pictured in the slide and who was also in this conference today. She's an absolute rock star. Anything I learned with detailing, I learned from Mary. So Mary, thank you if you are listening. We also now have my new colleague, Mark Schecker, who is, I believe, also on this call as well. So I'm really fortunate to have both the colleagues here supporting today and participating in NaRCAD. As I said, our overall focus is increasing access to PrEP throughout the state of Michigan. We do this by increasing provider knowledge of HIV PrEP, as well as our goal is to hopefully increase the number of providers that can prescribe PrEP actively in Michigan. We do have a list through the department that we're hoping to build on as we do each detailing session. So kind of looking back at the work that we've done throughout 2020, so we were fortunately able to do some pretty cool work throughout this year. We've done some group education sessions. We've done some one-on-one detailing sessions. Earlier, the presentation on one-on-one versus group really resonated with me because that's sort of been something we've been looking at as well. We've done some virtual webinar presentations, including this wonderful, wonderful conference, and ongoing technical assistance to several jurisdictions, both virtually and in person. Most of our activities did occur in January, February, and March of this year, mainly, of course, pre-COVID, but limited activities from end of March until present due to COVID-19, as I'm sure is the case in many, many other jurisdictions. One of the days I actually want to focus on is a day that we had spent in Flint, Michigan. So Flint is a city in our state. From Lansing, it's about maybe 45 minutes or so driving, which is where I'm based out of, in Lansing, of course. It's a part of the state that has a higher HIV incidence rate, but a smaller number of PrEP providers, making an ideal situation to detail. So one day in January, we actually had a really full day of fun activities throughout the city of Flint. We did some detailing visits to primary care offices, both family medicine and internal. We spoke with physicians and physician assistants that are interested in prescribing PrEP, so we were able to really get the word out. We talked to staff at urgent care centers who had increased testing rates for STDs, so sort of talked to them about the possibility of PrEP prescriptions. And we talked to administration at a teaching hospital in Flint called Hurley Medical Center. And the exciting part of that is that was a really fruitful meeting where we were able to get a grand rounds case presentation scheduled for later that month, which I will bring up shortly. So to kind of understand the need, I'm going to pivot just slightly and talk about the HIV incidence rates throughout the state of Michigan. This is our latest data for the state published for the year of 2019. As you can see, our highest incidence rate is in the city of Detroit, which is where the ending the HIV epidemic focus is in. For every 100,000 residents in 2019, there were about 27.2 new HIV diagnoses. Flint is located in Genesee County, which is the third county listed on this graph, with 7.9 new cases for every 100,000 residents. So as you can see, it was a city and a county with a higher need. I'd also like to put a brief focus on Wayne County, which is right underneath. So that's the fourth highest at 7.8 new cases for every 100,000 residents. Wayne County is going to be important because I'm also going to bring up the city of Dearborn shortly, and Dearborn is located in Wayne County. So those were kind of two of our main focuses at the beginning of this year. So part of the work we did were clinical case presentations. So we did give a total of 4 group presentations in January and February of this year, including our main grand rounds didactic presentation at Hurley Medical Center. It was at the end of January, and it focused on clinical cases, highlighting how to identify eligible patients to talk about and to prescribe PrEP. And the way we did that is, we put it in USMLE step 1, step 2, step 3 style questions, which is the medical board licensing exam, to sort of get those creative juices flowing and sort of think like a physician, if you will. These presentations were generally successful in that we were able to have the residents able to identify eligible PrEP candidates and start thinking. One of the cool things for me is after we finished our presentation, a couple of the residents came up to talk to us and they're saying, now that you mention it, I had a patient who fit exactly how your one case presentation was. Next time I see them, in the outpatient clinic, I'm going to start thinking about this, which is exactly what we wanted. One of the great things about this too, we were able to develop a relationship with the residents and sort of keep in touch with them. They're very responsive to a follow-up. The only unfortunate thing was due to COVID, it started right in March, so pretty soon after, we unfortunately were not able to get much of a follow-up just because priorities changed. They were heavily focused on COVID care rather than HIV prevention, but we were fortunately able to establish that relationship at least. Alrighty, so now pivoting to Dearborn, which is in Wayne County, so the 4th highest incidence rate of counties in the state. We did a detailing session with a primary care provider in Dearborn who was family medicine. Again, Wayne County, including the city of Dearborn, has a high HIV incidence rate, the 4th highest in the state, and a need for more PrEP providers as well. This was another really successful detailing session. It kind of holds a special place in my heart, actually, because this was my first solo session where I flew solo without my fellow detailer. So it was a little nerve-wracking, but it did go really well, which I was very fortunate about. The conversation was really good. We talked about PrEP. Another thing that we sort of pivoted on was we talked about STD management, including herpes. Kind of threw me for a loop because I came in with all my details about Truvada and Descovy, talking about PrEP. I had no idea about all the cyclovirs for herpes, but it sort of gave me a chance to sort of think on my feet and learn because I pulled one of the, I don't know off the top of my head, but I'm going to look into that and get back for you. Did a couple of days of research and got back to that provider by the end of the week. So that was kind of a good learning session. But we also had a really good conversation and that I got a lot of good insight on the community as well as provider perceptions on HIV prevention and sexual health. So kind of reflecting now back on what's all happened in 2020, of course, COVID-19 presented a very significant challenge. For a good part of the year, the detailers were actually working full-time on COVID-19 emergency response, and then even part-time from May until now. So, of course, that diverted a little bit of time, as well as provider priorities shifting. Providers before that were very interested in HIV prevention, ended up slipping to the back burner, which now it's still sort of half and half. Some are coming back, some are still on the back burner, but that's something that we're trying to work around. Other things that have kind of been happening is, of course, the transition to virtual e-detailing. You know, unfortunately, that was paused due to pausing in HIV prevention activities, but that is coming back now. We're very excited to say we have our first official e-detailing session on the 30th of this month, so we're preparing for that. As well as kind of everything with PrEP. We did have some staffing changes at the state of Michigan. So I personally actually had a period of time where anything related to PrEP, including PrEP navigation, new projects, detailing, education, was sort of my domain. So I feel like now one of the good things about 2020 is I learned a lot more about PrEP and feel much better equipped to detail about it. So kind of in summation, if there's anything that I learned, things can change at a moment's notice and it can last for a while. So the importance of flexibility is a real thing, and it is very important. And I kind of going back to whoever had said creative or creativity in the word poll, there's a great need for creativity to continue providing the services that we do. So what's next for Michigan and the rest of 2020 and 2021? E-detailing, we have our first session on the 30th, so it's going to be a great, hopefully a really good session and a great learning experience. And from there, my hope is we can only get better and continue improving our e-detailing. The long-term goal is to allow for an option of both in-person and e-detailing when able to do so. You know, geographically, there's the Upper Peninsula. It's not exactly the, the most convenient place to drive to, especially in the winter. So hopefully we'll be able to get some balance of e-detailing with in-person when allowed. As well as we're currently editing our materials, improving them to talk about both Truvada and Descovy, as well as now hoping to focus on generic Truvada. That will be, a major portion as well. Other things going on is we actually have another presentation for Hurley coming up in December for the new cohort of residents. And one thing that I personally am really excited about is being able to develop a new relationship and maintain this relationship for the long run with the residents as well. And another thing is we are working with Michigan Public Health Institute, one of our funders, to provide continuing medical education credits as well for detailing. So that's also in the works. And hopefully, as we continue on to 2021, we're going to return to the same vigor and speed as pre-COVID and continue providing great services in Michigan.
Amazing. We have no doubt, Vishal. Thank you so much, and great energy in wrapping up our day. Our yearbook segment is something new that we've tried, and we're so glad that we did, hoping that there are many people on the call who might be able to join this same segment just a year from now. If you have any questions for any of these three terrific groups, please do send them either via chat box or to us at narcad@partners.org, or shortly we will indeed have up a contact list on our conference hub. Thank you to all three of you from Maryland, Michigan, and Wisconsin. We appreciate you and all your hard work and willingness to share. All right, we're going to wrap up. I promised to have you out of here at 3:55, so hang on with me and let's wrap this up in a neat little bow. Pop up to your poll everywhere, and over the last 3 days, what is the number one key takeaway that will make your future work more impactful? You can choose a word, a phrase, content, knowledge, a mentor. Tell us what is on your mind. All right, storytelling, flexibility, not on my agenda, right? It's not what's in it for you, it's what's in it for that clinician. We're all in the same boat. Make one ask, innovate, bring the energy, do some phone call visits, start somewhere. I love that. Bring in the passion, the creativity, the service, positive outlook. Yes, and that's hard sometimes. And I just can't say thank you enough to all of the people over the past 3 days who really have genuinely brought positivity during a time of much darkness. Thank you for that. AD community, yes, I'm about to share some things you can join in on with us that we're excited to spearhead, but also let you all lead as our community members. Excitement, empathy does not mean agreement. Yes, I love that. And it looks like we're having an overflow of responses. Really appreciate all of your participation over the past couple days. One more, two more actually. What do you want to see on the 2021 conference agenda? What's something you wish we covered? What's something you want to cover? You can put yourself if you want to be on the agenda. All right, kicking us off, health equity, yes. The enterprise mindset, outcomes data, yes, we do want more of that. More about non-opioid pain management, hopefully in person. Yes, whoever said that, we hope people in person, and delicious morning eclairs. Pediatrics, Bevan as Oprah. Stigma, yes, let's dive more into stigma, pizza rolls. I know that was you, Anna Morgan. Creativity, identifying providers for diabetes detailing, prep, so many things. And yes, more breakout sessions. We got that feedback. For those of you who want to do breakout sessions next year, start thinking about what you want to do. Old fart medicine, I think that might be Jerry, because he's the type to write fart in a chat box. Yes, empathy. That's a great place to wrap up. Last one, what's one thing you're looking forward to in work or in life? I think that's a holdover from the last one. Do we have puppies? The end of COVID. Yes. Amen. Thanksgiving. All right. Sleep. Dinner out. Family taking a break. Face-to-face meetings. Grad school. All right. Whoever's going to grad school. I think that's Winnie, actually, but it could be a lot of other people, too. Being able to socialize more NaRCAD. Really? Really? You're just saying that. Healing, yes. Brief communications with more groups, stretchy pants. Stretchy pants can happen now. You can set that goal for now, stretchy pants. Being able to just see 2021, rest and happiness. Let's wrap it up there. All right, here's the 7-minute wrap up or shorter. Thank you to all of you. You're so dynamic and wonderful. You've stuck with us over 3 days. We can't say enough how much we love and appreciate your enthusiasm, your energy, your passion, and your incredibly hard work and dedication to this field. You are now on our mailing list. We are BFF for life. You can opt out at any time. We hope you won't. Those of you who are already on our mailing list, thanks for keeping your eyes on all of our blasts, including our new virtual offerings, which I'm going to tell you about in a minute. By the end of the week, probably, right, Anna? We're going to have some conference resources online, including our program book, session content, speaker info, contact info, video recordings, slides and handouts, and a resource list of everything that Winnie and Subine have been curating that you've been throwing our way. Thanks for keeping us on our toes, and please do continue chatting on our discussion forum. We are committed to continuing to support your e-detailing work with an eye out for in-person work coming back into the main stage. We will keep capturing and sharing best practices. Do check out our details blog. So much good stuff going on. We are going to offer new programs and opportunities to connect you with each other, including our 2021 Peer Connection Cohort. Keep your eyes on your email. We're continuing to curate the best AD literature, so check out our archives online. And we're going to continue our webinar series into 2021. We've covered topics like these, and we want you to tell us what you want to hear next. This is a great thing that Winnie's put together on our discussion forum, the weirdest field visits. We've had people detailing in a prison, joining a session where people were playing guitar in a circle. We know that Brandon accidentally asked a clinician if they've had sex with their patients. Some people have done sessions in cars, and our own friend Amanda Kennedy detailed 2 staff members in a barn with baby ducks. So if you can top any of those, pop on over to our discussion forum and let us know. You can sign up on our homepage under the community tab. And last but not least, I am excited to announce the official launch of our first AD Techniques training series of 2021. Yes, it'll be virtual. It will be limited. Registration opens 12/15/20. You'll get a blast if you are on our mailing list, which you are now. And we will have at least quarterly offerings to train you and your whole team. So with that in mind, it is 3:54. Please join us with the survey link in the chat box to fill out your final day 3 evaluation. If you missed days 1 and 2, we'll pop those in there as well. Your narrative feedback is so valuable to us. Please tell us how you feel. Tell us what didn't work. Tell us what did work, and tell us if you'll join us next year. There's still time to complete your other evals, and you will be entered to win our $50 raffle each day to have a donation made in your name to Partners in Health or many other global and national health organizations. With that in mind, I'm going to turn it over to our director, Mike Fisher, to share some closing words. I know that for me, I want to say a special thank you to Jerry Avorn, Anna Morgan, Winnie Ho, and Sue Bean. They have all been so terrific in making this 3-day event so much more fun than sitting on your butt for 3 days really should be. And you all have made it all the more fantastic with your incredible insights, chat box expertise, the ways that I'm noticing you all help each other in answering each other's questions. We couldn't have made this as special as it is without you. So over to Mike. Mike, let's wrap up.
Absolutely, and I will keep it nice and brief. I would echo everything Devin has said, really gratitude, but since she was too modest to call out herself, she has led our team in having to pivot from just as we were getting the conference announcements out and getting things lined up to realizing that the whole world was changing. Obviously, we're mindful of the fact that there are plenty of people out there who have experienced worse challenges than we have this year, but nonetheless, it was a lot of hard work to make this effective. And I like to think that by having such an engaged community and an amazing team, we can be part of the solutions to the problems that we're facing with the pandemic and in healthcare overall. And it really is seeing how many of you were logged on and stayed logged on and were commenting and engaged is inspiring to us. We do what we do because we feel like it can really reach clinicians and through them make a difference in health outcomes and the health of the populations that we serve overall. And it is deeply meaningful to see that, and we really appreciate you. We have the best team, and I just can't say how much I appreciate the work that they've done. So as Bevan said, thanks to all of you for being here and your energy. Thanks to everyone on our home team, to Jerry for getting us started with academic detailing in the first place, to Bevan for leading us through, Anna, Winnie, Subin, all the hard work you put in. It makes a huge difference. So feel free, the comments in the chat are really nice, and feel free to keep them coming. Do join the discussion forum. Winnie and others have done great work on that, and the energy that you've all been showing here really can carry on there, and you can keep sharing ideas with each other. And we're looking forward to seeing you in 2021, whether in person or virtual. We certainly hope in person, to keep learning from you and to keep growing together. And with that, let's call it a wrap. Give us those evals. Let us know what we can do better. We're here to try to help you do better, and we love it when you help us do better. Thank you, thank you, thank you, and we will see you all again very soon.
Thanks, guys. See you soon. Have a wonderful rest of your night. Thanks for being here. Thank you to all the presenters. Take care.
Or rest of your morning if you're in Australia.
Right, or the rest of your morning, Deb Rowett. And Harold, get a nice night's sleep. All right.
Incredible.
All right. And we'll just make sure I keep putting evaluation. All right.
Yes, happy Thanksgiving to everyone as well.
Yes, happy Thanksgiving, everyone. And if anybody has any challenges with their evaluation, do not hesitate to reach out to us. All right. Thank you, NaRCADians. Thank you, Brenda Schuster. Follow NaRCADian. All right. Anything left, Anna, Winnie, Subin, Mike?
All good. Excellent job.
Yeah.
All right.
Yeah, I think.
Well, I'm gonna. Oh, go right ahead.
I was going to say, is there anything? I mean, as long as people have the eval link, we don't need to keep the Zoom open for them to do the eval, right?
Yeah, I think we're good. What do you think, Anna?
Yeah, we're down to like 30 people anyway, so I think everyone who's going to click on the eval has been able to click on it, presumably. Yeah.
Yes, so we sent it a lot, so I think people have it.
Sorry, I couldn't stop. And we're sending it via email too. All right, I'm going to stop the share and I'm going to end the meeting. Thank you guys so much, and we'll talk tomorrow. Also, I'll be online probably for the next hour if anyone needs anything. Thank you again, Subin. We appreciate you so much for jumping in.
Great stuff.
Take care.
Talk to you all soon.
Bye, everyone.